On this edition of Independent Sources, Medicaid and immigration reform, the debate over a presidential executive order that could provide hundreds of thousands of undocumented immigrants with health care, but cost the state millions.
We believe that people having access to coverage and being able to see a physician when they need to and not waiting for weeks or months while a condition gets worse is in the end going to probably result in reduced healthcare costs as opposed to increased ones.
And who is Boko Haram? The origins and influence of the militant Islamic group wreaking havoc in Nigeria.
One of the reasons why Boko Haram became influential in the first place was because of the high levels of poverty, I think, in the area.
Those stories and more coming up on Independent Sources. Welcome to Independent Sources, bringing you news from New York's ethnic and immigrant communities. I'm Sarah Pizon. President Obama's announcement of an immigration overhaul could make Medicaid available to more than 300,000 undocumented immigrants in New York State. Immigration advocates are hailing the legislation as a means of providing much-needed health care to people who may not be able to afford it otherwise. Detractors say that it will be an added strain on the state that already spends more than $21 billion a year on Medicaid. Gary Pierre spoke to Claudia Calhoun of the New York Immigration Coalition about the legislation and the brewing debate.
Claudia, President Obama has consistently told the American people that under his health care bill that about 27 million undocumented immigrants would not be covered. That's not necessarily true, is it?
In New York State has some very good, strong protections for health care consumers in general, and particularly for immigrants. And so while it is true that federal subsidies and qualified health plans that are part of Obamacare, the Affordable Care Act, immigrants who are not documented are generally not able to participate in those plans. There are ways that immigrants have benefited greatly through Obamacare, and especially looking forward to the president's executive order as it's implemented. Many of those people, once they get DACA or DAPA, and I can talk about what those mean, they'll be eligible to apply for Medicaid.
Well, talk to us a little bit about that, this so-called emergency Medicaid, and how does that work, and how is New York State utilizing it?
New York has a generous emergency Medicaid program, and it provides coverage for individuals who have emergency conditions. And it is a way that hospitals and healthcare facilities that care for people with emergency conditions, they can get reimbursed for that care. And it is an important way that people get covered who wouldn't otherwise be able to get health care. Mm-hmm. And in addition, people who have DACA and DAPA will be able to actually. Well,
this is the second time you mentioned DACA and DAPA, so why
don't
you
want me to tell you what those are?
Please.
Okay, sure, absolutely. DACA was part of the president's order that was announced.
It's an acronym for what? DACA?
It's Deferred Action for Childhood Arrivals, mm-hmm. And then DAPA is part of the new executive order, which is Deferred Action for Parents of American Citizens.
And in plain English, what does deferred action mean?
Deferred action means that people get to live without the fear of being deported. Okay. And so people who have that status in New York, if they make under the income eligibility, if they don't make too much money, then they would be eligible for Medicaid. And that's one of the messages we want to be sure to get out.
And then what is that exactly? What is the minimum that you can make to be eligible?
It's 138% of the federal poverty level, which in plain English, that works out to, for one person, it's about $16,000 a year.
That's pretty low.
It's pretty low. For a family of 5, it works out to about a little bit under, about $38,000 a year. So many people, even if they do get administrative relief and don't have to worry about being deported because of executive action, they will still be without options for coverage through New York State, and that is where emergency Medicaid comes in, and that's where our public health network.
The emergency Medicaid is about $2 billion. That's at the federal level. And so how do the states administer their part of it? Where do they get the money from?
So each state has their own program, and each state gets to make a decision about how it's operated. And I wouldn't be able to speculate on exactly sort of how it is structured, but states do. New York State has some
let's
degree
talk about
of
New York.
New York, yeah, they have some degree of oversight to be able to decide how they're going to pay hospitals and healthcare providers for care that's considered to be an emergency.
You know, I've done some research on this, and New York leads the nation in 2011, for instance. It spent $528 million in emergency Medicaid for nearly 30,000 people. Is that really the best use of resources? I mean, shouldn't there be a system by which we don't have to spend that kind of money for that many people where you still can cover the undocumented? Can that be done?
There are certainly many ways that we could structure our healthcare system differently and perhaps provide coverage to more. But I think the key thing for us that we, in our work in the New York Immigration Coalition, is that we are really focused on making sure that given the system that we have right now, we are making sure to maximize the number of immigrants who are able to access one kind of a care and another. And that's part of the message that we really try to get out to immigrant communities is that although there are some programs that have certain eligibility, there are healthcare services there is something for everyone, and we really encourage immigrants to reach out to us or to other organizations that can help link them to public health care providers like the Health and Hospitals Corporation or like federally qualified health centers. And we also encourage people to go to the New York State of Health, which is the Obamacare marketplace, and to see what they qualify for, because they might, without even knowing it, be eligible for Medicaid depending on if they have DACA or DAPA or depending on what their immigration status is.
You know, for people who are not qualified, and I'm assuming we're talking about millions of people here. How do they get the health care?
A lot of people get health care from New York City Health and Hospitals Corporation, which is a really great resource, which is like Bellevue or Woodhull or Metropolitan. Those are really important institutions that make health access available to hundreds of thousands of people. And also across New York State, outside of New York City, we do have federally qualified health centers. They get funding as part of the Affordable Care Act. They got funding to expand their services and provide care to anyone who needs services. But it is not a perfect system. It is a patchwork, and it is something that people have to learn to navigate. And that is something we try to help them with.
Not too long ago, you know, the narrative on this issue was that the poor and a lot of immigrants would use the emergency room as sort of like their a clinic or a doctor. Is that still going on? And have we been able, with this reform, bring that system under some kind of order, if you will? Yeah,
there's a lot of reasons why people might be more likely to go to the emergency room than to a primary care doctor. Part of it is access. If it's easier to go to the ED than to get an appointment, you might be more likely to do that. But that's one of the reasons why coverage and Medicaid is really important. It's because if people know that if they know how to get in touch with a primary care doctor, and they have a primary care doctor that they know, and they know they can get in when they need it, and that person is invested, has communicated to them that they're invested in their health outcomes and improving their health outcomes, then we think people are much more likely to try to see a doctor in a clinic setting or an ambulatory setting than go to the emergency room. And so that's one of the reasons that we really advocate for broader access, because it's going to help them in how they access healthcare, but also it's going to help the system work better for them and for everyone.
There's a lot of talk about, you know, how much this is going to cost each state, and it's a staggering amount of money, and there's some resistance to it. What do you say to the critics of this?
So we spend a lot of money on healthcare in this country, and the purpose of healthcare is to keep people healthy. and we want people to be able to access services in the most effective way for them. And we believe that people having access to coverage and being able to see a physician when they need to and not waiting for weeks or months while a condition gets worse is in the end going to probably result in reduced healthcare costs as opposed to increased ones. And so that is one of the things that we advocate for, is that immigrants know that they can get access to healthcare coverage when they need it. And we try to get out the best information to them about where the services are available as much as possible.
Thank you very much. We're out of time. Claudia Calhoun, thanks for joining us.
Absolutely. Thank you.
Still to come on the show, who are Nigeria's Boko Haram Islamists? Before that, Crystal Lowe has some other news.
Thanks, Sarah. Here's a look at some headlines from New York's ethnic and community media. Chinese nail salons are posing a real threat to Korean nail salons around the city. The Korea Daily reports, the nail industry plays a significant role in the economy of Korean immigrants in New York. Recently, Chinese immigrants have gained a growing market share in the industry because of their competitive prices. Korean owners, for the most part, are opting to develop target investments and services outside of the nail industry rather than compete with undercut prices. Industry workers say that with this trend, the industry will be overtaken by Chinese-owned businesses within the next 10 years. In other news from the Chinese community, World Journal reports that a Chinatown meat market that has been in business for over half a century has finally closed its doors. Han Mei Meat Co. was a family-owned meat market that was popular with its loyal customers for ensuring that their meat products were prepared specifically to each patron's liking. Unfortunately, earlier this month, the market was forced to close its doors permanently after being phased out by supermarket chains. Owner Thomas Lee says, nowadays markets that specialize in one major product can no longer compete with supermarkets. The Sag Harbor Express reports on a new play titled Honor Killing that explores the cross-cultural treatment of women in the U.S. and abroad. Playwright Sarah Bierstock tells the story of Allison Williams, a New York Times reporter who travels to Pakistan to cover the murder of a young woman who married against her family's wishes. The play was inspired by a highly controversial stoning of a Pakistani woman in May 2014. She was killed after she defied her father by attempting to marry someone other than the man he had selected for her. The play is part of a series of artistic works staged at the John Drew Theater Lab in East Hampton, Long Island. And finally, the Lowdown reports on a 100 Gates program, a program inspired by Lower East Side artist and skateboarder Billy Rohan. The program was recently awarded a $30,000 grant through the Lower East Side Business Improvement District as part of the Neighborhood Challenge initiative. Rohan and his girlfriend Jessica Blowers came up with the concept as a means of enlivening the drab gates that protect storefronts after business hours. The gate painting initiative will take place later this year once the weather gets warmer. Those were just a few headlines from the city's ethnic and community media. Independent sources will be right back.
Thanks for staying tuned. The Nigerian militant Islamist group Boko Haram has been making headlines for a series of bombings, killings, and kidnappings rain upon Africa's most populous country. The group's followers believe that it is forbidden, or haram, to partake of any social or political activity associated with Western culture. Gary Pierre spoke to political science professor Mojubaolu Okome about how a group that was once seen as positive for going after corrupt police is now a scourge on the very country it sought to save.
Dr. Okome, Boko Haram came to our consciousness with the kidnapping of the 200 girls about last year. What can you tell us about this group?
Well, the group has been in existence long before last year. It was, when it was founded, it was small, and I guess its agenda was also small. It wanted to exert influence. It had some public education sort of function. It did some feeding programs and so forth. But after its leader was captured and got killed in police custody, the group got radicalized because the leaders that succeeded him increasingly became more radical. And then the current leader, Abubakar Shekau, has been the most brutal leader of the group. And I think it's under his watch that the girls were kidnapped. But that's not the first kidnapping, and it's also not the first atrocity that Boko Haram committed.
I read that the group was founded. One of the earlier tasks that it did was to really go after corrupt police officers and go after some corrupt apparatus of the Nigerian government. How true is that?
Well, I think in the tradition of many reformist groups in Islam, Boko Haram also was critical of the excesses of government, and it criticized government corruption, but it's also, I think, not to be distanced too much from that sort of thing, because there are allegations that one of the principal funders of Boko Haram was a former governor of Borno State. Mm-hmm. So I think the group might have criticized, but it also was not averse to taking
it was itself corrupt.
Yes.
Is that what you're trying to say?
Right. But I think that endeared, that element of criticizing government excesses and seeming to be anti-corruption probably endeared it to many of the ordinary people who, the area where Boko Haram has been most active is also some of the poorest areas in Nigeria.
So the northern part of Nigeria, which is predominantly Muslim, right?
Well, the north is predominantly Muslim, but I think it's important to realize that there are also Christians in the north.
Now, can the Nigerian state deal with this problem?
It's a puzzle to me that the Nigerian army has not been able to curtail Boko Haram's activities. But then if one looks at how much corruption has been not only alleged, but is being uncovered concerning the military and the spending of military allocations in, extra constitutional ways, people embezzling and so forth, then one might see why the army has not been able to curtail Boko Haram.
How big is this Boko Haram group?
One of the frustrating things about Nigeria is that nobody can give you categorically or even guesstimates that are close to reality numbers of anything. For a long time, nobody even knew how many of the girls were abducted. Nobody can tell you how many people have been killed as a result of Boko Haram attacks in Nigeria today. Nobody can tell you then, also how many Boko Haram people there are. But maybe the number in the, low thousands.
Is this simply a military operation? Can you take care of this problem militarily only?
Not anymore. I think that, one of the reasons why Boko Haram became influential in the first place was because of the high levels of poverty, I think, in the area. And the fact that it was able to, there were feeding programs that it had. It also had some schools where it did some education. I think these made Boko Haram maybe acceptable to people as maybe if a body of people that wanted to help, to lift people out of poverty. If you don't address the problems of poverty and the marginalization of poor people in Nigeria, I don't think you can totally correct the problems that have created Boko Haram. Can it be just a purely military operation? I think it has a military element to it. And then, there's now an unfolding humanitarian crisis because of the large numbers of internally displaced people and also refugees that are in neighboring countries. And then the group is not only operating in Nigeria, it's operating in Cameroon, it's operating in Chad, and it's operating in Niger. So, it's spreading its tentacles in West Africa.
So this month, Nigeria holds elections. And how is the issue of Boko Haram being played in the campaign?
It's shocking to me that the president of Nigeria constantly downplays or even sometimes seems to ignore the depredation of Boko Haram. The matter of the girls is not really raised in any sort of way that shows that the Nigerian government is concerned about what's happening. So it seems as if the government's strategy is that it should ignore the problem and then it disappears. I don't know. Also, there's been very little information being given to the people of Nigeria about what's happening in the northeastern parts of the country and what the government's strategy is to, address the problems. The APC, on the other hand, which is the government party, the governing party right now, is the PDP.
What's the PDP?
People's Democratic Party.
Okay.
The APC, All Parties Congress, has been more forthright and outspoken about Boko Haram and the matter of the abducted girls. And so, you have a difference in terms of the way in which each party is addressing this. Of course, there are other parties, but those are the two big ones, yeah. Okay. And, in terms of the people of Nigeria, I am disappointed. You know about the Bring Back Our Girls groups. They have been the ones that have talked and brought attention to this matter. There are people who demonstrate, who are campaigning and trying to persuade the government to take more action and more interest and, help to rescue the girls and reunite them with their families. But the level of just apathy on the part of Nigerians in general is disappointing to me. And I wish more Nigerians who feel very strongly when you talk to them about this would also lift up their voices and call on the government to do something about this.
It sounds to me, and tell me if I'm wrong, that the Nigerian state really cannot handle the situation, that it needs help, and it's not asking for that help. Is that accurate? Is that fair?
Has the Nigerian government asked for help? I think so. But I also see the Nigerian government not being clear in its messaging. Okay. I see it as not giving an organized response to the matter of these girls, to the matter of Boko Haram. And I see its response, what little there is, as woefully inadequate and very disappointing.
Unfortunately, we are out of time. Dr. Okome, thanks for joining us.
Thank you.
When we come back, celebrating Black independent filmmakers. Finally from us, the Film Society of Lincoln Center is currently celebrating the city's Black independent filmmakers in a series called Tell It Like It Is. Abby Ishola sat down with the festival's co-programmer, Michelle Materre.
Michelle Materre, thank you for being with me today.
Thank you for having me.
So you're the founder of Creatively Speaking, a film series that's been around for almost 2 decades.
That's correct.
Wow. What prompted you to start that?
Well, when we started Creatively Speaking, it was because we found there was a plethora of independent filmmakers making work that was not getting the kinds of exposure that it should have received. And so we created a series that would give filmmakers the opportunity to bring their work to the audiences that they intended to see it. And so particularly filmmakers of color who had a lot of short films that didn't really have an outlet. So we started creating these packages, a thematic program of short films into feature-length programs. And while it sounds like sort of every day today, 20 years ago, that was something new. Mm-hmm. And so it really has become a venue and a forum for filmmakers to be able to present their work, and many have gone on from Creatively Speaking to make their first feature films, like Malcolm Lee used to show with us when he was fresh out of film school. And I could go on with a list of filmmakers who we've had come through.
Wow. So your latest project, Tell It Like It Is, will be at Lincoln Center.
Yes.
And it's a survey of films from 1968 to
1986.
Yes. Black filmmakers.
Exactly.
So tell me a little bit more about this survey.
This program was actually the brainchild of my co-programmer, Jake Perlin, who's programmer at large at the Film Society for Lincoln Center. He invited me to work with him on this, and I was thrilled to do so because this is a time period when, you know, just the act of picking up a camera and getting a film made was really a revolutionary act. You know, this is pre-video. This is pre-cell phone. You know, it wasn't so easy to just pick up a video camera and run out and shoot something. And this was also during an era when the civil rights movement had just been, you know, brought to the forefront in 1968. The advent of television actually was just becoming popularized. And so Black independent filmmakers wanted to counter the negative imagery that we were seeing through the fire hosing of many Black people, the fire bombing of the young Black girls. And as a result, a huge body of work emerged from independent filmmakers working both on the East Coast and the West Coast, but more attention was brought to the filmmakers on the West Coast. So this was a way to sort of show counter-programming of what was happening simultaneously on the East Coast during this era.
So how are you distinguishing the early filmmakers from the ones that came later in the 80s, like Spike Lee?
Well, these are all the predecessors for Spike Lee. For John Singleton. These are people like Bill Greaves, St. Clair Bourne, Bill Miles, Madeline Anderson, Jessie Maple. These are women and men who, again, were at the forefront of making inroads into places like public television, where we had no visibility before, we had no representation before. And so the importance of this era is that these are works that people don't really see or don't really know much about. And so it's important, as we know, to know what happened before so that we can make progress and go forward. And so our mission, so if you would, is to really bring this work to light and people get to see the work that they have not seen before. For example, our opening night film, Losing Ground, that was just recently restored by Milestone Films. And that's a film that would have been one of the first films by an African-American female director to be theatrically released.
Wow.
It never had a theatrical release in 1982 when it was created. And so here we are now able, with this series, to give life to this film again. It's going to have a theatrical release. So we're very, very thrilled with that.
That's amazing. And, you know, to talk about Black independent filmmakers now, we know of Ava DuVernay and we know of Tyler Perry, who's made a ton of money. What's the climate like overall for independent filmmakers who are of color?
Well, I think the climate, you know, because of the access of to technology, that it's much easier to get things done, that we definitely have more opportunities. However, it also means that we have to be more selective about what we show and what we select, because anybody thinks that they can be a filmmaker. And of course, for those who've gone through film school or journalism school, we know that's not the case. And you know, this is an opportunity to make sure that we get our own stories told, that we're representing ourselves well. And now we have that opportunity because the technology has made it easier.
I'm not sure if you could speak for Lincoln Center, but is this something that they're going to be doing ongoing, showing African American filmmakers in this way?
I cannot speak for Lincoln Center. It would be great if we could sort of kickstart something with this series. But I do know that Jake and I are committed to getting the selection of work for this series shown in as many offsites as we can. We're actually talking to Maisel Cinema in Harlem. We're talking to Miss Cinema in Harlem to try and get this work seen in broader audiences, because it is that important.
So, Michelle Materre, thank you so much for being with us.
Oh, thank you so much.
The festival runs from February 6th to February 19th. For a list of the films and their showtimes, you can go to the website filmlink.com. That's our show this week. Thanks for staying tuned. Till next time, be independent-minded.